Hello, friends. It's an honor for me to be before you today and to discuss a topic that is so important and concerns our lives today. That is hearing health. This topic is so much overlooked because hearing is one of the most vital senses that connects us to the world, to our loved ones, and to all our surroundings. Yet, it is the most neglected because hearing loss is a very silent process. It's a slow process and often goes unnoticed. Today, I want to talk to you about the early detection and the prevention of hearing loss and the steps we can take to protect our gift of hearing. Hearing loss is called the silent epidemic because it develops slowly and often goes unnoticed. As of today, about 1.5 billion people in the world suffer from some or the other forms of hearing loss. And it is estimated that in today's trends, about 2.5 billion people in the world will suffer from the same by 2050. The most important fact is that in 60% of children and 50% of adults, this hearing loss can be prevented if it is detected early and intervened timely. Hearing loss does not just affect our ability to hear, but it results in loss of communication. It results in deficiencies in education, in our employment, our ability to interact, communicate, and enjoy the world. Untreated hearing loss can lead to social isolation, to depression, to loss of employment. All these can be avoided if it is detected early and intervened timely. Just as we routinely check our blood pressure, routinely do blood tests for our health, routinely get our eyes checked up, so hearing tests should also be routinely and systematically be done. It is not just a problem of adults, but even children and teenagers are at the risk of hearing loss due to the environment, genetic factors, the gadgets that we use, and so on. What can you do about it? First is to recognize the signs of hearing loss. If you have to raise the volume of the television or your gadgets too frequently and it becomes uncomfortable for others, that is a sign. If you have to often ask others to repeat what they said, it should be noticed. The third is if you are experiencing ringing in your ears, that is known as tinnitus, that also could be an early sign of hearing loss. Second is getting screened. Hearing test is a very simple test that is available at an audiological center or a center that is equipped to deal with the same. A simple test can tell us the level of our hearing or any hearing loss and the type of hearing loss that is present. If on the test it shows a hearing loss, then immediate action should be taken, the cause should be determined and appropriate steps taken to counter the same. Prevention is a very important factor in hearing losses. We should all take efforts to prevent ourselves from getting a hearing loss. How can we do that? The first most important thing is to regulate our hearing. That is, avoid very loud noises, avoid areas where there is persistent loud noises, because prolonged exposure to loud sounds can lead to hearing loss. Second is to follow what I say, the 60-60 rule. Do not listen to our gadgets, our mobile phones with earphones or headphones at more than 60% of the volume for more than 60% at a time. We should vaccinate our children when they are young at the appropriate time for measles, mumps, rubella, because these are the infective causes that can lead to hearing losses. We should avoid inserting any objects inside our ears, and we should keep our ears dry and clean. Conditions like diabetes, other illnesses, chronic illnesses, and smoking can also affect our hearing, so we should take efforts to control or stay away from these illnesses and vices and control these illnesses if we suffer from them. One of the most important cases in hearing losses is the stigma attached to it. Many people, out of shame or stigma, do not want to go for a hearing checkup because they feel that if they use a hearing aid, they will be considered old or out of place. But let me tell you, this is not so. Hearing loss is so common in society, and as I said, it affects not only adults or older adults, but also children and teenagers. And if out of shame or stigma, they do not take corrective action, then this can result in other problems as well. So that is why it's most important to get rid of that stigma. It is no longer a social stigma or a malady as perceived by some people. So again, as a hearing professional, I urge you all to take your hearing health seriously, to schedule routine checkups for your hearing tests, get in touch with a hearing professional and discuss the issues that you might be facing. Let us now pledge to educate ourselves about hearing and the disorders that are there. Let us pledge to get in touch with a professional in time when we need one, and let us pledge to be kind and considerate to people who have a hearing loss in society. Thank you.